Hi, my name is Jessica Lue-Lai. I'm from One Medical Group, and today I'm going to be talking about engaging your primary care provider and how to make the most of the time that you have with your primary care provider. First of all, I wanted to talk about what is primary care to begin with. This is from the Institute of Medicine. It's the provision of integrated, accessible healthcare services by clinicians who are accountable for addressing a large majority of personal healthcare needs, developing a sustained partnership with patients, and practicing in the context of family and community. What I love about this quote is that it says to develop a sustained partnership with patients. It's really important to develop that relationship with your primary care provider. Why does primary care matter? About 17 to 25% of patients do not have a primary care provider. What's great about primary care is that you can catch problems early. Some problems, they might not be on your radar at all. For example, if your blood pressure starts to rise and you can catch high blood pressure early, you have less chance of getting a heart attack or a stroke in the future. It also lowers the odds of premature death if you can catch things early. It lowers the cost. A lot of times, some people, if they don't have a primary care provider, they go to urgent care or the emergency room, and those visits can be quite costly. It's great if you can have a primary care provider that you can see on a regular basis, that you can catch things, even short-term acute issues. It's great to also have a patient-provider relationship. It's important to have continuity of care because you can truly have some personalized care. If you don't see the same provider over and over again, you might have fragmented care since they might not be able to see the whole picture. Also, communication is very important between primary care and between patients. Primary care, they're like the quarterbacks of healthcare. They help to coordinate care and they can help you navigate between your specialists and chronic disease. They can work with you to figure out what the next step should be, such as if you're due for any immunizations, if you need any preventative health screenings, any cancer screenings. Also, they can help manage any short-term acute problems or any long-term chronic problems. This is from Primary Care Progress. If everyone saw a primary care provider, the U.S. would save an estimated $67 billion every year. What does primary care do? Here are just some range of things that we ask for, especially at physicals, and also for short acute visits. For acute issues, such as if you're having some trouble breathing, if you have any abdominal pain, any joint pain, feel free to, of course, see your primary care provider. We also manage chronic issues, such as high blood pressure, diabetes, any asthma issues, any issues that you've developed over time. We review your allergies, and we also review your medication list. We check if there's any interactions between your medications. Also, we review your surgical history and your family history. Family history can be very important because if you have any sort of cancer in your history, that could be a genetic cause, that can be very important and applicable. Other chronic diseases can run in families as well. It's also important to review your occupation because sometimes your occupation can affect your health, such as if you're at your desk for a very long time, it can affect your posture. If you're working in a factory or exposed to certain chemicals, it can affect the way you breathe. Also, your living environment, making sure that's safe and good for your health as well. Reviewing any smoking, alcohol, recreational drugs, also important to your health, as some of these things can certainly cause adverse effects to your health. Sexual health is also important, and also preventing getting sexually transmitted infections. This is an article that was from Johns Hopkins University and New York University, and this is a quote from it. Adults with a primary care provider have 19% lower odds of premature death than those who only see specialists. So I wanted to go over what to do to choose your primary care provider, because this is very important to have that relationship. I recommend consulting some friends, some relatives, and coworkers, see what other people are seeing, and they have a good relationship with their primary care provider. Also, check to see who's in network with your insurance provider. How easy is it to get an appointment with this provider? Sometimes it can take weeks or months, and that can be very difficult to build that relationship with your primary care provider. And if you have an acute urgent need, it's important that you can get in when you need to. How easy is it to communicate with your provider? Are you able to send messages? Are you able to have your calls returned in a timely fashion from your provider? That's also very important to have that open line of communication. Clinical approach is also very important too. Some providers, they have a more evidence-based approach. They look at studies, they look at guidelines, they follow those very carefully. Some providers do some more complementary and alternative medicine. If that suits you, look for a doctor that specializes in more of that. Personality is also important. Does the provider make you feel comfortable enough to be honest and open? Do you click with the provider? Is this someone that you would want to see again? That can be a very important thing to build that relationship. Expertise is also important. Some providers, they have more interest in sports medicine or women's health, interest in diabetes, for example. Feel free to ask the clinic if certain providers have more experience or expertise in these sorts of areas. Just make sure the expertise suits your needs. Another thing to think about is, can you get to this primary care provider? Is it difficult to get to from work, from home? Does it work with your schedule? Are you able to, does the clinic have early hours, late hours that can accommodate you? That can be something that can be very important to you too. Now I also want to talk about how to improve communication with your primary care provider and how to make the most of your visit. At the beginning, it's great to set the agenda together with your provider, go over any acute or health concerns that you have, bring your list of issues. When did the issue start happening? Where did it start happening? Where is it hurting? How did it start happening? Qualify it. And for pain, what does it feel like? Think about those issues. If you have trouble remembering, feel free to write it down and bring it to your provider. Partner with your provider. Take notes, ask questions, see your doctor regularly. Know your medical history. If you had some sort of significant surgery or hospitalization, know when that happened. If you can obtain things like your vaccination records, that'd be great. If you can obtain your medical history records, that would be awesome to have, or definitely try to get it for your provider. And then keep your provider informed even outside the visit. If you end up going to a specialist and something significant happens, like you do have some sort of procedure, please let them know either at their visit or at the next visit with them, or you can feel free to message them or call them just to keep them informed. And then I just wanted to talk about what One Medical is, where I work. I work at the Chicago location. One Medical is a primary care office. It's a primary care office that's reinvented. It's very technology driven. We do high quality care, offering a range of primary care services. What a lot of people have frustrations with primary care, such as unable to see your doctor when you need to, have trouble waiting in the waiting room for so long, not able to communicate with your provider. We try to do away with those things. We start on time, we end on time. We have a virtual medical team to help assess needs outside of the office 24/7. We have same day and next day visits. We have a lab on site, and we have a practice in 8 cities. And feel free to check out our website at onemedical.com. Thank you very much. If you have any questions or comments, feel free to email me at jlu@lai@onemedical.com. Thank you.